Usually when we talk about a medical diagnosis, there is this comforting expectation of precision. It's almost like engineering.
Right. The system is really designed to find that visible binary issue. Like it's either broken or it's not.
Exactly. It's clean. If you
Yeah.
break your arm, the X-ray shows that jagged white line. The doctor points to it and says, there it is. That's the problem.
Yeah, but then you step into the world of women's health.
Oh, and specifically post-reproductive health.
Yes. And suddenly that X-ray machine feels completely broken. We are looking at a diagnostic landscape that is just incredibly murky.
It really is. And, the numbers we are looking at today for this deep dive are absolutely staggering. I mean, imagine a medical condition that affects up to 84% of a specific demographic. 84%.
It is a massive number. We're talking about the vast majority of a population experiencing this.
But here is the kicker, and honestly the main reason we're doing this deep dive. Out of that 84% who experience the symptoms we're going to discuss today, only about 7% ever receive treatment for them.
Which is it's the definition of a diagnostic blind spot. We have this phenomenon that affects nearly everyone in this demographic, yet it's treated as like a fringe issue, or worse, completely ignored.
Completely ignored.
Yeah.
So let's unpack this. Our mission today, whether you are listening to advocate for yourself, prepping to support a partner, or you're just insanely curious about how the human body adapts and sometimes fails to adapt, is to thoroughly explore a condition called Genitourinary Syndrome of Menopause.
Or GSM for short.
Right, GSM. We are focusing strictly on the symptoms today because this is, frankly, a silent epidemic. It's so common, yet kept so incredibly quiet.
And breaking that silence is exactly why we need to have this conversation, because the prevailing attitude among patients, and shockingly a lot of healthcare providers, is that these symptoms are just, well, a natural, unavoidable part of aging.
Like you're just supposed to deal with it.
Exactly. The underlying message is that you're supposed to just grit your teeth and bear the discomfort. But our goal here is to empower you to recognize these signs for what they actually are, which is a specific, treatable medical condition.
Treatable being the operative word there.
Yes. Because unlike hot flashes, which are, famous for being a menopausal symptom that usually peaks and then improves with time, GSM is chronic. It is progressive.
Wow.
Without intervention, it does not magically go away. It only gets worse.
That is such a crucial distinction. It doesn't fade out. It, digs in. So to start making sense of this condition, we actually have to look at the name itself.
Right. The naming history is fascinating.
It is, because the name of this condition changed relatively recently, and that change acts as a literal map of where all these symptoms happen in the body. The old terms in our sources were things like vulvovaginal atrophy or atrophic vaginitis.
Yeah.
And I'll be honest, those sound like archaic terms from some 1950s medical textbook. They just feel really reductive.
Well, they are entirely inadequate, and the medical community finally recognized that. The term Genitourinary Syndrome of Menopause, or GSM, was only introduced in 2014.
Wait, 2014, which is basically yesterday in medical science.
It did, yeah. It took that long. The shift was absolutely necessary because vulvovaginal atrophy completely misses the massive urinary component of the condition.
It implies the problem is just localized to the vagina.
Right. But GSM is a comprehensive umbrella term. To understand the underlying mechanics of this, we really have to look at cellular anatomy.
Okay, let's get into the mechanics.
So estrogen receptors and testosterone receptors as well, actually, they aren't just located in the vagina. They are densely packed throughout the entire genitourinary tract.
Meaning they're distributed much wider than people realize.
Correct. I mean, we are talking about the urethra, the bladder trigone.
What's a trigone?
Oh, it's the smooth, highly sensitive triangular region at the base of the bladder.
Got it.
And all the surrounding pelvic floor muscles.
So it's not just isolated tissues. It's more like this whole connected neighborhood that relies on the exact same power grid.
That is a brilliant way to visualize it. Estrogen is the electrical current keeping the neighborhood's infrastructure robust.
And when hormone levels drop, that power grid goes down.
Exactly. And this drop can happen due to natural menopause or the years leading up to it, perimenopause. But it also happens from breastfeeding, the surgical removal of ovaries, or cancer treatments like chemotherapy and pelvic radiation.
Wow. So there are a lot of ways to lose power.
A lot of ways. And when that power grid fails, all of these interconnected tissues suffer simultaneously. They are all starved of the fundamental hormone that keeps them healthy, elastic, and functioning.
So if the whole neighborhood is losing power, it makes total sense that the infrastructure starts to physically decay. Let's look at what is physically happening to the body, starting with the genital half of that genitourinary word.
Let's do it.
The most striking visual analogy I've come across in the sources compares a healthy vaginal lining to a plump, stretchy accordion.
Yes, those are the vaginal rugae.
Right. These specialized folds of tissue that allow for, like, incredible expansion, stretch, and resilience. But with GSM, that accordion loses its folds.
It
It
does.
basically completely flattens out. Wait, so does the body's actual architecture change?
It is a total structural collapse. Let's break down exactly what happens when that tissue is starved of estrogen over a prolonged period.
Okay.
First, you have severe dryness and thinning. This is often the initial, most bothersome symptom people notice.
Makes sense.
Without estrogen, the body essentially stops producing as many superficial epithelial cells. These are the cells that protect the surface. Furthermore, you lose collagen and you lose elastin.
So the literal building blocks of the tissue are disappearing. The plump accordion loses its moisture, its stretch, and becomes this smooth, thin, rigid surface. That sounds incredibly uncomfortable just sitting there, let alone doing anything active.
And it becomes a much more serious issue than just discomfort. The tissue becomes what clinicians call friable,
Meaning highly fragile.
extremely fragile. A healthy vaginal lining is robust and pink because of a rich blood supply. When the power grid goes down, that blood supply is drastically reduced. The tissue becomes very pale, thin, and brittle.
Ugh, brittle tissue.
Yeah, and because of this friability, it can tear under the slightest pressure. This leads to painful fissures, which are essentially small cuts in the tissue, and something called petechia.
Petechia, right? Those are the tiny pinpoint bleeding spots, like microscopic hemorrhages right under the surface of the skin.
Precisely. The capillaries are so unsupported by the thinning tissue that they simply burst. And then, as the estrogen deprivation continues, we see actual anatomical shrinking.
This is a staggering reality that seems to be kept entirely in the shadows. We are talking about a literal loss of labial fullness.
Yes, the labia majora lose their underlying fat pads. And more severely, there can be actual resorption of the labia minora.
Resorption, meaning the body is essentially dissolving that tissue. The inner lips of the vulva can literally shrink and recede until they are almost gone.
That's right. And on top of the external shrinking, the vaginal canal itself can shorten and narrow. The medical term for this is introital stenosis.
Introital stenosis.
Right. The entrance to the vagina tightens significantly, and the canal loses its physical depth and its flexibility.
Just visualizing the mechanical reality of that. The canal shortening, the entrance tightening, the surrounding tissue becoming so paper thin and fragile that it bleeds from tiny pinpoint spots. It completely recontextualizes the final set of physical symptoms in this genital category.
The irritation.
Yes, the constant, unyielding irritation. It's no wonder people experience chronic burning and intense genital itching.
Well, the environment undergoes a total physiological disruption. Even the natural discharge changes fundamentally.
How so?
Instead of being healthy, acidic, and lubricating, it might become thin, watery, sticky, yellow, or even gray. The body is essentially signaling that its baseline defenses and maintenance systems have completely shut down.
Okay, so if the vaginal walls are undergoing this level of structural failure because of a lack of estrogen, it stands to reason that the tissue directly next door is suffering the exact same fate.
Absolutely.
And that takes us to the urinary half of Genitourinary Syndrome of Menopause. Because these tissues share the same embryonic origin, the structural collapse we just discussed spills right over into the bladder and the urethra.
They are inextricably linked. The smooth muscle in the lower urogenital tract literally atrophies right alongside the reproductive organs. The lining of the urethra thins out and becomes just as friable as the vaginal walls.
Now, I have to push back here for a second because I want to make sure we were correctly assigning blame to estrogen.
Fair enough.
A lot of people might assume, well, I'm getting older, my bladder muscles are just weak now, or I've had a few kids, of course I'm going to leak when I sneeze.
Right, the classic explanations.
Exactly. And regarding infections, aren't urinary tract infections in older populations often just a result of overall immune system decline? People's immune systems naturally get weaker as they age.
They do.
So how do we know these urinary issues are strictly an estrogen problem caused by GSM and not just the standard wear and tear of aging or regular overactive bladder?
That is a very important challenge, and honestly, it's a major reason why this goes undiagnosed. It is really easy to write it off as general aging.
Right.
But the key differentiator for a clinician is the clustering and the underlying chemistry of the symptoms. With general age-related muscle weakening or regular overactive bladder, the primary issue is usually just the incontinence.
Just the leaking.
Exactly. But with GSM, the patient usually presents with both urinary symptoms and those severe vaginal symptoms, the dryness, the friability, the architectural shrinking occurring simultaneously.
Ah, because it's the exact same power grid failing.
Exactly. The specific urinary symptoms driven by this estrogen starvation include a frequent or sudden urgent need to urinate, often waking the person up multiple times at night.
Which is exhausting on its own.
Totally. Then there's dysuria, which is a burning or sharp pain during urination caused by the thinning of the urethra. And there is definitely urine leakage.
Both kinds of leakage. Right?
Yes, both stress incontinence, like leaking when you cough or sneeze, because the supporting tissue has atrophied, and urge incontinence, where the signaling is misfiring and you just can't make it to the bathroom in time.
Okay, that perfectly explains the physical leaking and the muscle atrophy, but what about the infections? Because the sheer volume of recurrent urinary tract infections associated with GSM is astonishing.
It's huge.
I feel like society kind of jokes about UTIs or subtly attributes them to poor hygiene. But if it's not a weakened immune system, and it's not hygiene, what is the hormonal mechanism making the bladder such a magnet for bacteria?
This is perhaps one of the most fascinating ecological mechanisms in the entire human body. A healthy, estrogen-rich vagina is naturally highly acidic.
Okay.
And that acidic environment is actively maintained by a dominant type of good bacteria called lactobacilli. They basically act as the protective bouncers of the microbiome.
Huh. Microscopic bouncers guarding the doors to the club.
Exactly. They produce lactic acid to keep the pH low, which makes the environment completely inhospitable to bad infection-causing bacteria.
But when estrogen levels plummet,
The vaginal pH shifts drastically. It becomes more alkaline. Specifically, the pH rises above 4.5.
then what happens to the bouncers when the environment becomes alkaline?
They cannot survive. The lactobacilli die off.
Oh, wow.
And when the bouncers are gone, the doors are left completely unguarded. The entire microbiome undergoes an ecological collapse.
So anything can just wander in.
Exactly. Bad bacteria, specifically gut bacteria like E. coli, now have free rein to colonize the vagina, multiply rapidly, and travel right next door up the urethra and into the bladder.
That is a brilliant way to visualize it.
Yeah.
It totally shifts the blame away from hygiene or general aging
Yeah,
and puts it squarely on cellular chemistry.
it does.
It leaves the urinary tract highly susceptible to recurrent, painful infections simply because the protective ecosystem was starved of its foundational hormone.
It is a direct chain reaction. Hormone drop, pH rise, bacteria shift, recurrent infection. And treating the UTI with antibiotics only kills the current infection. It doesn't fix the underlying lack of estrogen, which is why they just keep coming back.
If the tissue is that fragile and the ecosystem is that compromised, you don't even need to be doing anything intense to feel the consequences.
Not at all.
And this really highlights the reality of living with this condition. It's one thing to list anatomical changes and microbial shifts on a clinical chart, but the way these physical and urinary symptoms actually manifest in a person's day-to-day life is just a constant low-level trauma.
The impact on the quality of daily life is profound. And tragically, because of the location of the pain, it is almost always suffered entirely in secret.
Right. Because if we look at the mechanics of this friable, thinning tissue, the pain isn't just an issue in the bedroom. We are talking about genuine, sharp agony doing the most mundane, everyday things.
Everyday things, yes.
Like, if you have lost your collagen and elastin, and your tissue is prone to tearing, suddenly riding a bike becomes impossible. Going for a brisk walk creates agonizing friction.
Or simply sitting down for a long period of time at an office desk or during a commute. The pressure of your own body weight against that structurally compromised tissue causes deep, persistent aching.
Even wearing tight jeans.
Yes.
Imagine having to quietly change your entire wardrobe because the sturdy fabric of your pants causes unbearable friction against your skin. Or, and this is the one that really underscores the severity, wiping with toilet paper after using the bathroom.
It's awful.
If the tissue is so friable that it develops petechiae and microscopic fissures, basic bathroom hygiene transforms from a mindless daily habit into an agonizing ordeal.
And living with that daily, unyielding baseline of discomfort drains a person's energy, focus, and overall well-being. It creates a state of chronic stress.
I can't even imagine.
But of course, beyond the daily mundane tasks, we must also address the severe impact this structural collapse has on sexual health and intimacy, which is often a primary catalyst for profound emotional distress.
We absolutely have to cover that because this is where the silence really does damage, not just to the individual, but to relationships.
Yeah.
The medical term for the pain experience here is dyspareunia, correct? Painful sex.
Yes, dyspareunia. And when we review the mechanics of GSM we've just discussed, it's entirely clear why intimacy becomes so painful.
You've got the lack of moisture.
Right, a severe decrease in natural lubrication. You have tissue fragility that literally tears under friction, frequently leading to light spotting or postcoital bleeding.
But the pain isn't just a direct result of the friction, is it? I mean, the body has a defensive reaction to that pain that makes the whole situation exponentially worse.
Exactly. The pain from the thinning tissue often triggers involuntary pelvic floor muscle spasms.
Involuntary.
Yes. The brain and the body anticipate the pain of penetration, and the muscles tense up defensively. This involuntary clamping down makes penetration even more difficult, which in turn creates more friction, more tearing, and more pain.
Wow.
It is a devastating, self-perpetuating cycle.
It's a physiological defense mechanism gone totally wrong. The body is trying to protect itself from injury, but in doing so, it makes intimacy impossible.
Precisely.
But there is another layer to this that goes beyond mechanical pain and muscle spasms. It isn't just a lack of physical lubrication or torn tissue. There is a deeply neurological component to GSM, right? Like an actual loss of physiological function and sensation.
This is a critical point that forces us to redefine how we view sexual health in older adults. GSM symptoms include a profound, chemically driven loss of libido and a decreased capacity for physical arousal.
Because of the blood flow.
Exactly. Remember earlier when we discussed the drastically reduced blood flow causing the vaginal tissue to appear pale?
Yes, the power grid being down means less blood is being pumped into the neighborhood.
Yeah. Right. And less blood flow means there is far less physical engorgement of the tissues during arousal. But furthermore, the fundamental lack of estrogen alters the body's touch perception. The nerve endings themselves change.
Wait, how do they change? Did they just stop working?
It manifests differently in different people, but usually in one of two extremes. For some, the area loses its sensitivity almost entirely.
It's numb.
Yeah, leading to a profound difficulty or complete inability to achieve orgasm, a condition called anorgasmia. The neurological pathways are essentially muted.
And the other extreme.
The nerves misfire in the opposite direction. The area becomes pathologically hypersensitive, where even the lightest, most gentle touch is perceived by the brain as intense burning or sharp pain.
So you are trapped between feeling absolutely nothing at all or feeling sheer agony.
It's incredibly distressing.
And meanwhile, maybe your partner has no idea what is happening physiologically. They might internalize it, thinking they're doing something wrong,
Yeah.
or that the attraction's gone.
Right, the communication aspect.
Yeah, and the person experiencing it might not have the medical vocabulary or, frankly, the courage to sit down and explain that their body is literally undergoing an architectural, microbial, and neurological collapse.
That communication breakdown is heartbreaking. It severely impacts self-esteem, destroys body image, and breeds resentment and isolation within a relationship, causing immense psychological distress that piles right on top of the physical pain.
Okay, let's take a breath and zoom out. We have covered a massive amount of incredibly dense, consequential ground today.
We really have.
If you are listening, the main thing we want to leave you with is a clear understanding of the sheer scale of this umbrella. Genitourinary Syndrome of Menopause GSM is not just one minor symptom. It is a cascading systemic failure.
A perfect way to put it.
It covers everything from severe dryness and the actual physical tearing of fragile tissue to the anatomical shrinking and shortening of the vaginal canal. It covers recurrent UTIs because your microbiome lost its protective bouncers all the way to painful sex, pelvic floor spasms, and the inability to sit comfortably in a pair of tight jeans.
Yes.
And it all stems from one root cause.
Yes.
A localized drop in hormones starving those dense receptors throughout the pelvis.
And if there is one definitive takeaway from everything we've discussed today, it is this. GSM is chronic and it is progressive. I cannot emphasize that enough.
Right.
It does not magically resolve itself. It slowly worsens as the estrogen deprivation continues. Recognizing these varied symptoms, understanding that your recurrent urinary tract infection is directly connected to the pain you feel during intimacy and the dryness you feel on a daily basis is the critical first step.
It's all connected.
It is. Whether you are advocating for your own health in a doctor's office, preparing yourself for the biological realities of the future, or looking out for a partner or loved one, you need the right vocabulary. You do not have to suffer in silence, and you absolutely do not have to accept chronic pain and bleeding as a normal part of getting older.
Absolutely. Which brings me back to where we started today, that broken X-ray machine, the invisible nature of this condition. I want to leave you with a final provocative thought to mull over on your own.
I love these.
We started with that staggering statistic. Up to 84% of postmenopausal people experience these severe symptoms, yet only about 7% ever get treated.
Such a huge gap.
If 84% of literally any other population experience chronic pain, bleeding, anatomical shrinking, and recurrent bacterial infections simply from sitting down, wearing pants, or trying to be intimate with their partner, why is this still such a taboo topic?
It's a great question.
What is it going to take for our society to view menopausal pain not as some secret, embarrassing burden to be endured in the shadows, but as a standard mechanical medical issue that deserves immediate validation and care?
It is ultimately a question of visibility. The pain is real, the mechanics are clear, we just need to bring them into the light.
Exactly. It's time to fix the X-ray machine. Thanks for taking this deep dive with us.